I feel that I should conquer PPH. So this is like, ek jang hai. And we have to emerge victorious. Because we have no choice. We are gynecologists, we are obstetricians. We've got to prove our mettle. So from the red, we come to white. And after my talk, again comes the red. So, so that is the power of the balloons. And while we've learned so many wonderful things, you can say noteworthy things, what I want to say is there are sometimes very simple things that you can do yourself. So that was the formal introduction after we've spent a whole day. And like I said, whatever we have and whatever we can do, we have to do. So yes, we keep adding things to the armamentarium, but here I am today to talk about a balloon that you can all make in your setups. Even if you have other balloons, don't forget this particular balloon because it's such a basic balloon and so easy and you can control PPH. So here goes my demonstration on how to make the Chhattisgarh balloon. Hello everyone. Today I am here to show you how to make a Chhattisgarh balloon. Postpartum hemorrhage is a cause of great mortality in our country. At any point of time, I have all the balloons that are there in my labor room. This is the PPH toolkit in which I keep the balloons, a simple Foley's catheter balloon, a Chhattisgarh balloon, a Bakri balloon and the Ilavi balloon. But today I am going to tell you how to make this one of the most simple, effective, reliable balloon, that is the Chhattisgarh balloon. Chhattisgarh balloon, as you know, it was invented in the state of Chhattisgarh by Dr. Nalini Mishra. So we have her to thank for making this very simple, very cost-effective balloon. For making this balloon, you need a Foley's catheter. You can use size number 18, 20, 24, whichever size you have with you. A pair of gloves, obviously you're going to wear them, but for demonstration I'm not going to be wearing them. You need simple packet of condoms. You need some 2 syringes. I have kept 20 cc syringes. Silk, some gauze pieces, 2 speculum, a sponge holder, a kidney bowl which has saline in it, a Euro bag, that's very essential, and of course for the demonstration here we have the Mama U, where I am going to demonstrate how to place the Chhattisgarh balloon. Now, the first and foremost thing is to open the Foley's catheter. It's a very good idea to have a good assistant with you when you are battling PPH, because things have to be really very fast and you have the golden hour. So it is in that period of time that you have to be very fast in instilling the balloon. This is it. Now the first thing that I am going to do is, I am going to make the bulb of this balloon prominent. So take in some air, push it through the bulb side. There. So it's a very prominent part. You can pop it or bust it with the help of scissors or with needle. There. A nice sound. Now what that happens is, you make this particular port, the bulb port, very prominent. You can chop off the extra tissue or you can even evert it. Just hold it. Just hold this. So like I said, it is a good idea if you keep some of these balloons already made, and so that you can use it, because when a patient has postpartum hemorrhage, you can never be sure. So here I have made this particular point, with this bulb port very prominent, as you can see. Now please hold it. The next step is to make the rubber bands. Now you may use the silk that is there, as you saw, but what happens with silk is, it does not cause a watertight compartment, and many times the saline starts leaking. So you may use your Foley's catheter itself to make these wonderful rubber bands. Now open the packet of condoms. and place it along the length of the Foley's catheter. Please hold it. Now these are lubricated. It will be a good idea if you could get a non-lubricated one, because otherwise they feel a little slippery on your hands. Just hold it from here, please. Now, the rubber bands. Take the first rubber band and place it about 1.5 centimeter from the tip, such that this particular point, this point is kept straight. You may take 2 twirls of it round the tip. Just hold it again. Yes. Hold this, please. Yeah. So you take 2 twirls around it so that it snugly fits around the tip, about 1.5 centimeters, and the drainage of this particular tip is a little away from where you have tied it. That's it. Please hold it from here. Now, keep the rest of the condom straight and apply the second rubber band. Now, these rubber bands are so good that once you start instilling, they are at the right pressure. They are not too tight, so they don't cause, preventing fluid from coming inside. At the same time, they so nicely snugly fit that you can, you know for sure that the fluid is not going to come out. That's it. So I have put these 2 rubber bands. Now once I have put these 2 rubber bands, my balloon is ready. Please hold it. The next step is to make a drainage port. So this particular port, I chop it along with the Foley's catheter and the condom over it, and make this part, this drainage port, prominent. So this is the drainage port. Now my balloon is ready for installation. It's a good idea to first check it before we use it inside. So here I have some fluid. I'm going to check it. Remember, you're going to instill from the bulb side. So here I am instilling to check whether the balloon is working. Is it filling us? Yes. Yes. So just check that both sides there is no leak. Right. So now we are ready to instill. Keep the Foley's ready and keep your drainage, that is the Euro bag, ready. The Euro bag should be put in this part, that is the drainage port, and this is very important because it tells you how much the patient is bleeding. Now we kept fluid in a kidney bowl and we instilled it with the help of a 20 or a 50 cc syringe. But if you like, please bring that. You can even use an IV stand. You can have a running flow of saline, and you can attach this to the Chhattisgarh balloon for rapid installation of saline. So both things you can do. Now we are ready. What is to be done? This is just to demonstrate how to place it. Depress the posterior wall of the vagina and the anterior wall and grasp the cervix with the help of a sponge holder. There. Now you may instill it and place the balloon with your gloved hands, or if you feel, you can even use hold this please. Then you can even put in maybe a long artery forceps. Make sure that the balloon goes right inside the uterine cavity and the lower part lies at the level of the external os. Now you must appreciate that sometimes with the sheer weight of the fluid that is instilled, the balloon can come out. So you must put in some gauze pieces inside, or maybe even a ribbon gauze, to pack the vagina in such a way that the balloon doesn't come out. Yes, now you can remove this also, and we start rapidly instilling. So your assistant will have an important job in this because they are rapidly going to be pushing fluid through this. As I had said, if you want, you can even use the IV fluid. You can attach the IV fluid to this. As you see, we have used a stopcock on it, and you can quickly run in a lot of fluid through this, through the IV fluid. The idea is to put at least 200 to 250 ml. At the same time, you are massaging the uterus, your drainage is coming out into the urobag. You are quite certain your patient is not bleeding that much, and you keep instilling till you are very confident that the bleeding has stopped. Usually about 300 to 350 ml is required. The capacity of this balloon is around 500 ml. So, dear friends, this is a very simple balloon. It is extremely cost effective. As I said, it just costs between 350 to 400 rupees. This can be made by any one of you, and it is a very important armamentarium in your toolkit. Keep it ready, practice it, make sure that your junior colleagues also know how to use it, because PPH, as I said, is very unpredictable, and when it happens, everyone in your obstetric team should know how to use these balloons. Okay, so that is the same as it is with any balloon, and that is 24 hours. And don't forget, you remember I had said about putting a gauze pad in. Always at the end of everything, whatever you've done, document it, and make sure that the next day when your balloon is removed, remove it at the rate of 50 ml. Every half an hour, pulse, blood pressure and the bleeding to be seen. Make sure that the pack that you have put in has also been removed. But remember, in case, despite your pack, this simple balloon suddenly comes out, don't worry. That means your patient is doing very well, because if the uterus contracts, it just expels the balloon. So you know that you've done your job. So don't get worried if your balloon comes out even before 24 hours.